Hi, Stefan Hartman here, Iron Direct Primary Care. I'm here with my friend Chris Kleronomos. Is that how you pronounce your last name?
Pretty close, Kleronomos.
Kleros. He's a family nurse practitioner with a doctorate in Oriental medicine and acupuncture and a master's in functional medicine. I met him last week at the Age Management Conference where he gave a fantastic lecture on peptide therapies and long COVID. And we're going to have to go into peptides, I think, over the next year and just kind of discuss these in detail because both you and I use these extensively. But I learned also that you're very into hyperbaric therapy. And I just purchased a hyperbaric chamber for the human performance arena that I have here. So I think this would be the perfect opportunity to learn about hyperbaric from you, what you've been using, and how you like it, right?
Yeah, great. Thanks for having me. I really appreciate it. I think everything you're doing, we're applying it differently, but we use very similar approaches. And that's kind of the beauty of all this, right? You can adapt all of it, layer them, and have this approach to however you want to apply it, right? You're using mostly performance. We're doing mostly chronic pain and fatigue. But it's the same therapies, right? Because you're addressing these underlying system dysfunctions, and whether you're tweaking them or you're trying to correct them, the pathways and the systems are the same.
They are. Yeah, and I hear that your clinic, it also has red light therapy and you have sauna and you have this neurofeedback. You have all these cool things. And you're looking at getting a cryotherapy pool as well, right?
I do. I love that idea. We'd been looking for a while. We most of our equipment is pretty small, right? We try to get high grade medical equipment, and then we have, similar to you, a room that people get a membership and come in and use. And I try and get them to layer some of those things. But cryo is something I need. That's super cool.
Super fun. Great. So yeah, you're in pain management and hyperbaric therapy. The way I was taught back in my surgical training is it's great for healing wounds, diabetic wounds, etc. But how do you use it in pain management?
Sure. Yeah, you're correct. There's only about 11 true FDA approved covered conditions, right, for true hyperbarics. And you're talking about, typically those are hard shelled
Yeah.
hard shelled medical chambers. What you and I are talking about is actually MHBOT, which is mild hyperbarics, right? So soft-sided chambers that or even lower grade hard shell chambers, right, that don't go beyond a certain atmosphere. So the one you and I have goes to 1.4 atmospheres. Some of the harder chambers can get to 3, but that's very different than the big medical chambers like that do burns and wounds and things like that. It's really, hyperbarics for pain management is really about inflammation, microcirculation, right, and oxygen carrying capacity, right? That's really the primary goal in pain management. But there's so many other benefits, right? Telomere lengthening, ox redox pathways, mitochondrial enhancement, all of those kind of things we need anyways,
Yeah.
right? So the way we utilize it is we added an oxygen concentrator, which I believe you did as well, because it's about the math, right? You and I were talking about this. When they say atmosphere is absolute, which is ATA, they're counting the weight of the atmosphere above us, right? So, and you and I are at sea level, right? Different coasts, but we're both at sea level. So that really means the chambers are getting to 0.4 depth of an atmosphere. And an atmosphere is 33 feet of seawater, right? So you take 33 feet, divide it by, 0.4, it's 14.7 pounds per square inch. So when you do that, if you don't add either supplemental oxygen or an oxygen concentrator, you're essentially you could sit in your living room with a mask and get pretty close to the same effect.
See.
So so you need that to make the math work, to get that partial pressure of gas in your system up to a certain, as high as you can get it, right?
Cool. So you have your patients sit in the chamber with a little mask on for oxygen.
We did a concentrator that floods the chamber, so we can get it up to about, I mean, it says about 97%
Yeah.
O2 in the chamber. I'm guessing there's probably a margin in there, so I usually calculate it at 90, 95.
Okay.
But that makes it significantly better when you add the O2. The main difference is, you've got to increase the frequency some,
Right.
because you're not getting that level of depth.
So you work in pain management. You have a very functional approach to this. Do you feel like the hyperbaric chamber can help people with common things like osteoarthritis, all these inflammatory conditions of the spine, et cetera, joints, et cetera?
Yeah, I think, I mean, I'm not a magic bullet person, right? I think 15 years in chronic pain and disease, you need that whole approach, right? You saw my lecture that was like annoyingly long, right? With all the things you got to do, right? And that's really what I believe, right? And it's no different than kind of your approach for performance, right? You have to hit all these things, right? And you're trying to shock, and activate different genomes with the cold and then the red light and then right? So same thing. I think when you're talking about those conditions like osteoarthritis and things like that, the hyperbarics addresses the inflammatory piece. If they're layered with sort of, poor metabolomics, right? They're obese or they eat poorly or things like that. You're probably getting some additional side benefits, right? Just because you are affecting that extracellular matrix with extra oxygen and getting it to places that it's probably not getting, right? Typically. That being said, the main issue when that's the case is you're getting a pretty transient effect because the faucet's still on for them, right? They're flooding with inflammatory and you're trying to anti-inflammatory them.
Wow. Good. I have a couple of slide decks here.
Yeah.
The International Hyperbarics Association, a couple of conditions where hyperbarics might apply. And it's like, oh, this is one obvious one. It talks about inflammation in hyperbarics. It reduces neuroinflammation with HBOT. That's interesting. That's what a lot of my patients are interested in. I mean, they have autistic children and they're interested, can this help with autism, that neuroinflammation in autism, right?
Mm-hmm. Yeah, and that's that. If you remember, we were talking about like the cell danger response. The person that did that research actually ran it on autistic children to get them out of that hypometabolic state. So, and all of that is primarily neural brain inflammation. So the more you can get that down, the better, the more system level corrections you get.
Yeah, I see that study here done by Daniel Rossignol. They looked at 2009 multi-center randomized controlled double-blind trial. They had 56 children with autism aged 2 to 7. And they did 6 separate HBOT centers, treated 30 children with 40 one-hour sessions over the course of 4 weeks. The remaining 26 children underwent a sham treatment. Upon completion of this study, 80% of the treatment group's mean physician clinical global impression scores for overall functioning, receptive language, social interaction, and eye contact significantly improved. Nice. So what's going on there? How is this working for the autistic brain?
My belief, and that's not my area, but if we based it on just the overall physiology, what I think is probably happening is when you reduce neural inflammation, you get this chain reaction of events, right? You increase ATP production. So that's the end result of all these processes, right? So then you're getting increased cellular energy. You're getting, in the hyperbarics, you're getting increased oxygen perfusion, right? And you're getting some epigenetic expression plus improved detoxification with SOD and things like that. So once you start targeting neural inflammation, you alter all sorts of systemic signaling pathways, and that's that cell danger response, right? So you have this, you're trying to reduce sympathetic tone and reactivate the parasympathetic system, and when that happens, you get more autonomic control, right? So because that's what's usually altered, and then these hypometabolic pathways are shut off. Gut brain access, it's a lot of the neural inflammation really tends to either affect or improve, when you treat it, that vagal nerve connection, cranial nerve 10, and that affects everything.
This says that it helps accelerate healing from sports-related high-impact injuries, helps ameliorate tendonitis, osteoarthritis, rheumatoid arthritis. Have you seen that in your clinic?
Yeah, I mean, I think I don't see a lot of sports injuries, though my son does use it because he's a runner. And I actually have been my mother was just in a terrible car accident, so we've been rotating like a trifecta of, I mean, she's bruised head to toe. She's 78 years old, a lot of arthritis. And so we put her on the PEMF mat, then put her in the chamber, and then red light after. So the thought process is, we get those calcium channels activated in the extracellular matrix, get the microcirculation opened up, bone density with the PMF, put her in the chamber for hyperoxygenation, and then kind of charge it with the red light.
All right. Cool.
Yeah, I think for sports injuries, you're probably, going to see a far better response quicker, right? The better the system is, the better response. Typically for chronically ill people, you've got to do a fair amount of treatments, right? Most places would say for mild hyperbarics, you need 30 treatments per session of therapy. So sports is probably less, right? Because they're healthier.
Let's see what they did here. In 2011, they did a case report involving NFL players who sustained multiple concussions and subsequently led to the development of hydrocephalus, which required emergency shunt brain surgery. The star athlete continued playing and won the Super Bowl, only for his shunt to fail, which led to additional emergencies back-to-back. Following his surgeries, he received 40 one-hour treatments of HBOT. After the treatment protocol, he was independently assessed with neurocognitive evaluations and a SPECT scan imaging done at the Amen Clinic. Oh, that's pretty cool. Marked improvement in 5 out of 6 indices in the microcog assessment for cognitive functioning. So that's cool. TBI. I like that.
Yeah, and we do a lot of that. That's one of our main indications for using it. And we pair that, obviously we pair that with a lot of peptides, like you and I discussed when we were having coffee there. We pair that with a lot of peptides that they're doing outside of the clinic. And then some vagal stimulation modulation for neural inflammation. Nice. And then while they're in the HBOT, we have a device called a V-Light, it's NeuroDuo V-Light. And it's basically, let's call it transmagnetic cranial stimulation light, right? It's not like strong enough like you're in a TMS chair for depression, but you can set it to alpha or gamma, so stimulating or calming in the setting. So depending on their symptomatic presentation, you can do that. And that's activating those areas of the brain mildly. But the key piece of this equipment is a nasal photobiomodulation in the right frequency. And when you can get that laser up, it's close enough that it'll penetrate and reach the brain. And so this is being studied at the University of Utah's, I don't know the exact name of it, but they have a concussion TBI center, and that's who's doing the research. So we tell them to wear that in the chamber.
Brilliant. Supposedly helps speed recovery from surgeries after HBOT by increasing fibroblast activation, reducing inflammation, reducing risk of infection, stimulating stem cell proliferation. Well, that's cool. That's right. It would reduce risk of inflammation because that's oxygenation therapy. Oxygenation destroys microbes. That's cool.
Exactly. And it is angiogenic to a degree, which is, somewhat counterintuitive because people, it's not my area, but people do use it for cancer, right?
Yeah.
To change the microenvironment, but it's angiogenic at the same time, which is interesting. Post-surgically, going to your peptides, we pair that with things like BPC and thymosin beta,
Yes.
right?
Of course. Alzheimer's, dementia, and hyperbarics apparently can improve attention, memory, increased concentration, improves the blood flow to the brain. They did a study in 2020 of healthy adults and the impact of HBOT on cognitive abilities, demonstrated that delivering high levels of oxygen along with pressure leads to significant improvement in tissue oxygenation. The main areas of improvement were attention, information processing speed, and executive function, in addition to global cognitive function, all of which typically decline with age. This was done in Tel Aviv in 2020. I like it.
Yeah, nice. I would say for mild HBOT, you'd probably need pretty regular treatments, but it's a similar approach to TBI, right? You're treating that neural inflammation.
Yeah.
In those cases, you'd pair it with maybe the neuropeptides, ARA 290, cerebral lysin, if you can get it.
As I
And
can.
then, yeah, you're doing that with the photobiomodulation, the perfusion. And my opinion would be to add, if they could manage it pre HBOT, at least periodically, methylene blue, because methylene blue increases the oxygen carrying capacity of cells, right, without needing the hemoglobin. So if you can then increase the oxygen partial pressure of gas, my hypothesis that we should get a better result, and actually it'd be the equivalent of being at a deeper depth.
That's something that I read here as well, is that doing like IV therapy or something, or even eating more nutrients, it increase your absorption of the nutrients doing the HBOT afterwards. I think that's really cool.
Yeah, that is cool. I don't know. I haven't seen a ton on that, but I would imagine it improves almost every pathway,
Yeah.
right? Certainly cellular perfusion. So,
This is cool. Stroke and hyperbarics. I think, is this an FDA indication? I don't know if they do this.
it may be. It may be. I'm not sure. I know it's burns, osteonecrosis, non-healing wounds, things like the perineal radiation therapies that cause those ulcerations. That's an approved one. Carbon monoxide. I'm not sure. I think stroke, but I'm not 100%.
Yeah, it looks like there's a study done by Elfrati Fishlev et al. In 2013. They did this neurological function improves post-stroke patients with HBOT. They looked at 59 participants. They did 2 months of 41-hour HBOT sessions, and all of them improved compared to the control group in cognitive functioning
Nice.
and post-stroke improvement. All right.
Well, did that say if it was bleeds or oxygen based?
Yeah, whether that was perfusion based or bleed based.
Yeah. I mean, I'm sure it would help both, but I wonder if there's a difference.
Yeah, most likely. Diabetes and hyperbarics. Yeah, this is where I was trained in it. We had the diabetes lab, and we had all the diabetics with the ulcers in the tanks. These were big metal tanks in this institute.
Yeah.
Trainings. But let's see. Improves fasting blood sugar. Interesting. Improves lipid profiles. I need that. Let's see. Improves brain function. Yeah. So let's see. Yeah, amputation rate decrease with HBOT. Well, yeah, that's why we use it. It cleans up those infections, helps them speed their wound healing.
Right. Yeah, the diabetic thing's interesting. Especially the lipids and A1C just from HBOT is pretty amazing, right?
I'm putting that to the test for myself now with the cryotherapy, because apparently cryotherapy can improve lipid parameters too.
Nice. And I wonder if that's, because of how it affects ox redox and shock proteins and things like that.
Well,
Uh,
it shifts your white adipose tissue to brown adipose tissue by regular cold exposure. Yeah.
yeah, that's the shock proteins. So, I mean, that's you don't have any adipose tissue. When you're old like me, you have a little more, but I mean, it's, all these things are essentially inducing hormesis, right? Some sort of hormetic stress to keep the body in balance, right?
Yeah.
Just cool.
Stem cells mobilize with HBOT. That's interesting study in 2005 by Stephen Bobali. And they did patients who are at risk for osteoradionecrosis after undergoing radiation therapy for head and neck tumors all underwent 22-hour HBOT treatments, and blood was collected and evaluated after the first, 10th, and 20th treatment. The population of CD34 cells in the peripheral circulation system doubled after the first treatment and increased eightfold by the end of the trial. Whoa.
Wow, that's pretty impressive.
And that's probably why it helps with healing of tissues.
Mm-hmm. Yeah, and it's interesting because that was about half the amount of time that we typically do for ill people. So in your population, that's a great intervention. But certainly mine needs it as well. That would be great paired with something like NAD
Ooh,
therapies, right?
I like NAD. Yeah, how do you do that? Injection or oral, sublingual?
If people don't mind the burn, if you will, I'll send them home with it and just have them do low dose sub Q,
Okay.
a few times a week. But a lot of people in a perfect world, probably you do a loading dose of IV and then send them home.
Yeah.
I would say most people request the IV, even though it's a little harsh, just because they feel like they get, a massive amount. So I usually just send them home with the remaining.
Yeah. The FLCCC has been talking about HBOT for COVID-19. Well, it makes sense.
Sure.
It's a disease of low oxygenation. If you can put
Yep.
people in a chamber and hyperoxygenate them, it makes sense that they could do better, acute COVID. But I'm considering using it in the spiculopathy, these long-term spiculopathy patients.
Mm-hmm.
See if we can improve some of their neuropathy pains, their vagal nerve dysfunction. They have all sorts of issues.
Yeah, 100%. I mean, it affects all of that, right? So, um, you know, not only the neural inflammation, but you're getting the peripheral nerves as well.
Yeah. And that's huge with these patients who've also been vaccine injured. They always have some level of peripheral issues,
Yeah,
pain, numbness, tingling, weird
yeah.
stuff. I didn't know it helped with addiction recovery. Apparently, it can help alcohol withdrawal.
Hmm.
Interesting.
That's a new one.
That's a new one. This study looked at 30 alcohol dependent patients were recruited. They were divided into an HBOT group and they received it for 90 minutes, and a non-HBOT group. Using simple randomization technique, withdrawal symptoms were assessed daily. Let's see. When the two groups were compared, it was found that the mean period in days required for the control of withdrawal symptoms for the HBOT group was 3.72, and for the non-HBOT group, it was 9.03. Okay.
Wow. Ah, that's super interesting.
Apparently, it
Um,
aids in cellular detoxification, repairs damaged neurons,
hmm.
improves circulation, regenerates tissues, improves sleep patterns.
Yeah, interesting. I mean, sure, I guess the neuroplastic effects and that downstream HPA, right, and neurotransmitter adjustment and the SOD for and glutathione for cellular stuff. But I hadn't known that one. That's I guess, the bottom line is put somebody in a hyperbaric chamber,
See
right?
what happens. Do a case study. See what happens. Cerebral palsy. They did this one with a 1.5 ATA, 100% oxygen delivered through a hood. Oh, wow. After 8 months, all four groups improved in the HBOT group. Very cool. And their fine motor functions improved. That's pretty cool. We have one more here. Plastic surgery. Less scarring, less bruising, less infection, quicker healing. Yeah, makes sense.
Yeah.
Very good. That's all the cards I have. You have any other things you want to add?
Nice. I mean, we apply it I mean, I guess same as you, applying it differently, but it's an anchor therapy. I would say, I try to get the majority of my patients to utilize the equipment because you can layer them so well. It's really about time and compliance, right? As you see, most of those studies are 20 to 40 treatments, right? With the average being 30. So, and they're done over a relatively short period of time, 2 to 4 weeks. So you're coming daily, right? And it's a couple, it's an hour to go to depth and then come up and then drive to the clinic, et cetera. So I'd say that's it's logistics is really the primary limitation, but otherwise I would be putting everybody that I could get in it, right?
I'm trying to streamline it here. So, it's a self-access system. Patients can go there once they've been trained how to use it. I foresee them just being able to use this by themselves when they need it.
Yeah. Yeah. And as long as you train them, I mean, these mild HBOT chambers are really safe. I mean, they could literally blow and you're only coming up to depth, less than the deep end of a swimming pool, right? You're not going to have those, you're not going to have dive type injuries, right? Bends or embolisms or something like that. Now, in my population, I do worry a lot of them have chronic sinus stuff and ear stuff. So I train them on the Valsalva and just ensure and remind them I have a big sign to not clear on the way up, because that's probably the major risk is a mild barotrauma of the ear.
You mean not clearing their sinuses? Like
Yeah,
blow
not clearing their eustachian tubes,
Yeah,
right?
you wouldn't want to blow your nose in there.
No, going down, you can equalize if you're a little congested. Because going to depth is fine. You're putting pressure in, but coming up, you don't want to add pressure because the air is expanding.
Right. No.
So
Exactly. Cool. I think we covered a lot there. I think that can help introduce some of my patients to this, because this is all new for a lot of people. No one has had access to this before in my area. That's why I'm developing this program. So, people can do it affordably. So, it's a membership. You can go when you want.
that's awesome. That's a really cool model. I mean, and it makes people, engaged in their care, which I like.
Exactly. That's the whole point with what I do, right? I give my patients a lot of autonomy, like, hey, I'm not telling you what to do, right? You have to want to do this. You have to want to get better yourself, right? And this is all what I do is case studies. It's all experimental, really, right? There's a lot of whole guidance in this way. It's N of one. If they're case studies, we see what works. If it doesn't, we try something else. We give us reports back, of course.
Yeah, it's great. I mean, a lot of functional medicine, as good as the science is, right? It's really still people like you and I extrapolating that data and trying to come up with workable protocols. And it's, at some point, I'm assuming they'll get to developed studies, right? But at this point, like you said, it's on us. So the best we can do is utilize the best science and try and get people where they need to be.
Yeah, and publishing on YouTube. I think that's because, it's difficult for us to publish studies. I don't know how you are. I'm not associated with a university. It's hard to get, that sort of publication.
Yeah, for sure. And the publications, that we have access to, as good as they are, and it's similar to lecturing, right? We're all kind of preaching to the choir, learning from each other because we're the people doing this, right? What I'd like to see next is it expanding, which I think we are seeing, slower than I'd hoped, but that's where we need to get so that all these people can have access.
Yeah. Fantastic. All right, we'll do this again, okay?
Yeah, thank you. And then now next time you can school me up on the cryo.
Oh yeah, sure. All right.